Hi dear students, welcome back to my YouTube channel. Today we would be covering the second part of test series. I'm hoping you all have gone through the very first part of test series. You have attempted the questions along with me and you have noted down what score you got. In case you did not do that, go back and do it first so that you can attempt the second series along with me. Yes, the second series will not be as easy as compared to the first one. So yes, you need to brush up a little more. So let's begin with the very second series of this. And again, yes, I will help you recapitulate this thing time and again in all the test series that you'll be having 240 questions in your NEET MDS examinations. Each correct question or each correct answer will give you 4 marks, and each incorrect response will help you deduct 1 mark. Okay, so that is the last thing which we want. But yes, we do have negative markings in NEET MDS exam, and -1 would be given for each wrong response. So yes, if you are not at all sure of any question, do not take the risk of attempting it and simply leave it unattempted, because 0 marks 0 marks would be deducted if you do not attempt a particular question. I'm sorry. Yes. So students, be very careful. We do not want negative markings, right? So yes, you should know that your target is your NEET MDS examinations or PSC examinations, INI, whatever you are appearing for. We do not want you people to waste 1 year, take a drop and prepare for the exams again. Okay, so study well in the very first attempt. An entire set of orthodontics, I am there to help you out, people. Okay, just go through all the videos that are there on the YouTube channel. Just don't be behind, it just to attempt MCQs. Your theory portion has to be really strong. So each video lecture is of what, say 30 to 40 minutes maximum. I'm sure you people can spare that much amount of time. Go through the YouTube video and start watching the videos. After you have watched 1 or 2 videos, take out your time and then attempt the MCQs. But what I would suggest is start the preparations in the same systematic and chronological manner in which I am uploading the videos. The video which has been uploaded first, attempt that first. Do not skip any video in between, because everything is linked to one another. Okay, my fourth video is linked to the previous 3 videos. These MCQs are linked to the lectures which have already been uploaded. So don't miss out on anything and don't be in a hurry. Orthodontics is tough, we all know that, okay? And maybe 20% of the students do not read ortho and come. So you should be the ones who are watching this video to stand apart from the crowd, and you should be in a position to attempt all the ortho questions, right? So with that, again, I'll help you recapitulate that image-based questions and patient-based questions have made their way into the examinations, and they're extremely important. So prepare accordingly. So I hope your pen and paper is ready with you. Let us start with the very first question. Labial displacement of maxillary canine leading to crowding in maxillary anterior segment due to lack of space is mainly caused by. So what are they trying to tell here is there is lack of space in the maxillary arch. As a result, my maxillary canine has moved labially and there is crowding in anterior region. Okay, so this is a case of labially placed canine. My maxillary canine is not able to erupt into the arch because of crowding. Why is it happening? Because eruption of maxillary canine before that of maxillary first premolar. Okay, so the question is the lack of space is due to, or it is caused by, eruption of canine before that of maxillary first premolar. Okay, eruption of maxillary lateral incisor before that of maxillary canine. Okay, eruption of maxillary canine before that of maxillary lateral incisor, or is it eruption of maxillary first premolar before that of maxillary canine? So let us just rule out option C and D first. That is eruption of canine before maxillary lateral incisor. This does not happen. My lateral incisor erupts first. Eruption of premolar before canine, no, even this does not happen because I know my chronologies and my canine is erupting first. This is happening because of eruption of canine before that of first premolar. Okay, my canine erupts before the first premolar. So that is why there is labial displacement of maxillary canine leading to displacement. So from this question, what you gather is the chronological events which are events which are occurring is one thing which you have to be very clear about. Okay. Moving on to the next question. A 9-year-old child came to the dental clinic with spacing in anterior teeth. The line of treatment is things to be highlighted. 9-year-old spacing in anterior teeth. So, if you have gone through the previous test series, you know that spacing in anterior teeth at this particular age is common and desirable. Okay, so the line of treatment is absolutely no treatment observation of the patient. You do not wish to start with removable appliance therapy or fixed appliance therapy, right? Patient is a 9-year-old child. Maybe she's in the ugly duckling stage. Teeth are yet erupting. Okay, so we do not want to start with any of the appliance. We want the natural eruption to occur. Okay. Next question. Difference in the width of permanent and primary incisor is. We know that the width of permanent incisor is more than that of primary incisor. And this difference in the width is known as incisor liability. Okay. I hope this is visible. The last option is incisor liability. Is it coming? Wait. Pen. Yes. Okay, I'm not able to highlight it over here, but the options which are given are incisal guidance. No. Incisal guidance, incisal inclination, overjet, or incisal liability. See, incisal inclination, no. Difference in width doesn't play a role. Overjet is a different concept. So the answer here is incisal liability. Okay, next. How much force is required to tip an incisor? We know that to move a teeth, we need force. Okay. Now to move a teeth, there can be two kind of force. That is tipping kind of force and torquing kind of force. Tip. When we talking about tip, we are talking about crown movement. When we are using the terminology torque, we are talking about root movement. Okay, so it is obviously easier to move a crown when compared to a root. So when we want to tip a central incisor or lateral incisor, we require 50 to 75 grams of force. Okay, the amount of force required to tip a lower or a mandibular central incisor is obviously less as compared to the maxillary central incisor because of the difference in the mesiodistal width, because of the difference in the shape and size of the root. Okay, but if the question is how much force is required to tip an incisor, we'll just play very safe and take 50 to 75 grams. Okay, next, safety valve mechanism is. Okay, again, if you have watched my previous video, you have read in depth about safety valve mechanism because one video is completely on safety valve mechanism only. So students, kindly highlight that this is an important topic from all the perspectives, BDS, entrance exams and MDS. Okay. So safety valve is the anteroposterior increment in the maxilla at 14 years, increase in mandibular intercanine width at 14 years, increase in mandibular height at 12 years, or increase in maxillary intercanine width at 12 years. So let us play the ruling out game. Let us rule out B and C completely because safety valve mechanism has nothing to do with mandibular height or mandibular intercanine width. Okay, my safety valve is maxillary intercanine width. Okay, so yes, I had explained very well in the safety valve mechanism lecture. The safety valve which we talk about is my maxillary intercanine arch width. So the correct option is answer D. Okay, next question. Midline diastema present in children is self-correcting if diastema is not more than. We know that midline diastema is a self-correcting anomaly when we are talking about ugly duckling stage. So they are asking, okay, if the midline diastema is of what millimeters that it will get corrected on its own and it will not require orthodontic intervention. So the cutoff is 2 millimeters. All the studies say that a midline diastema of 2 millimeters or less is self-correcting. Okay. Moving on, so yes, the correct answer over here is option A. The next question which we have is, column angle is seen in which malocclusion? Before you can attempt this question, you should know what is column angle. So column angle is basically the angle between crown and root of a particular tooth. How come? Let us see. What we do, we draw a straight line along the long axis of the crown and the long axis of the root. So suppose this is a straight line along the long axis of the crown and this is a straight line along the long axis of the root. If we get an angulation between them, that angle becomes my column angle. And column angle is only seen in my class 2 division malocclusion. Why? Because in class 2 division 2 malocclusion, my upper central incisors are tipped lingually or palatally. Okay, entire tooth is not moving bodily, only the crown portion is tipped lingually. So if this is my root portion and this is my crown, okay, it is not that the entire tooth is moving lingually. My root position is this, just the crowns have tipped lingually. So as a result, the long axis of the root does not coincide with the long axis of the crown, and this leads to the formation of a particular angle which is known as a column angle. So yes, in this figure you can appreciate that when we draw a straight line passing through the long axis of crown and root, if we get an angle in between, that is known as column angle, and it is seen in cases of class 2 division 2 malocclusions. Okay? Right. Next question. Very important. The pitch of hyrax expansion is pitch of hyrax expansion. So this is your hyrax expansion screw. This is basically a jack screw, and this is hyrax appliance. Hyrax appliance are used for rapid palatal expansion. They can either be banded or they can be bonded. Okay, so this was about hyrax. Now what is pitch of the appliance? Pitch of the appliance is basically the amount of distance it can move the plate away. See, in this kind of jack screw, there is a hole which is present in between. We take the key, put it into the hole and rotate it this way. Okay? As a result, my appliance opens up. When my appliance opens, what happens? It will exert force onto the maxillary area. Okay? And my sutures, anterior sutures gets opened up, resulting in expansion of maxilla. Okay, so what happens? The pitch is the amount of distance it can open when you're rotating it by one turn, and the answer is 1 millimeter. So when you insert the key, take one turn, the amount of distance it will open up or it will expand is the pitch, and that is equal to 1 millimeter. Okay, so there is this important topic in orthodontics, that is expansion. Expansion can be slow or it can be rapid. Hyrax expansion is used in rapid expansion. Okay, so it is used to bring about skeletal changes. Moving on. Oh, your 10 questions are over. Right, students. So I hope you all have done the questions along with me. Okay, so whatever it is, you have scored yourself, and I hope the scores are better. Let me tell you that these set of questions were a little difficult because we have not covered in lectures about expansion, first thing. Next, column angle was something which I am sure is new for you people. Safety valve mechanism we have done. Okay, and yes, tipping, torquing, amount of force required. Biomechanics we have not yet covered. So yes, it could be a difficult question for you people. Rest I think were relatively easy. So yes, I feel that maybe you all have got a 7 or 8 out of 10 in this. Okay, if you have got this, good, well enough, not bad. Keep the scores with you, highlight the questions which were incorrect. What all you have to do is go back and read these topics, come back and re-attempt these questions. Okay, students, so stay tuned to my channel, okay, so that you know the things and the topics which have to be read. Open up the channel, take up any topic and read it. Take up any MCQ and keep attempting it. Okay, and there is a lot more things which are coming up, so all you have to do is stay tuned, because yes, as written, more exciting events are coming up. So yes, study well, all the best, and thank you so much.